High blood pressure is called the silent killer. You can feel completely fine and still be damaging your heart, brain, and kidney. I've seen patients in urgent care with stroke symptoms who didn't know their blood pressure was high. Today, I'll explain what normal blood pressure actually is, when it becomes dangerous, and 7 evidence based ways to lower it naturally. Let's make this simple. Blood pressure is written as two numbers. The top number is called systolic, and this is the blood pressure when the heart pumps. The bottom number is called the diastolic, and this is the blood pressure when the heart relaxes. As a general guide, blood pressure around 120 over 80 millimeters of mercury is considered ideal. Blood pressure between 130 and 139 systolic is considered elevated, and blood pressure 140 over 90 or above is considered as hypertension. In clinic, we confirm diagnosis with multiple readings or home monitoring. One eye reading alone does not mean you have hypertension. Secondly, why is high blood pressure dangerous? High blood pressure damages arteries slowly over time, and this increases the risk of heart attack, stroke, heart failure, kidney disease, and vascular dementia. The challenge is this: most people have no symptoms. Headaches are not a reliable indicator, and that's why measurement matters. Thirdly, who is at higher risk? You are at increased risk if you have a family history, belly fat or central obesity, diabetes, high salt diet, sedentary lifestyle, chronic stressor, and poor sleep. In South Asian and African population, risk starts earlier and progresses faster, which is why prevention is crucial. So let's talk about the 7 evidence-based ways to lower blood pressure naturally. And this is where it becomes practical. 1. Aim for less than 6 grams of salt per day. The biggest problem isn't the table salt, it's processed foods. Try to read labels of the food you're eating and try to cook fresh meals when possible. Even small reductions can drop your systolic blood pressure by 5 to 6 millimeters of mercury. Number 2, lose 5 to 10% of body weight. Even a modest weight loss significantly lowers blood pressure. You don't need extreme dieting. Just focus on protein first meals and reducing refined carbohydrates, and consistent movement matters. Number 3, walk daily. 30 minutes of brisk walking 5 days a week can reduce systolic pressure by 4 to 9 millimeters of mercury. Even 10 minutes walk after meals help. Number 4 is strength training. Muscle improves vascular function and insulin sensitivity. Ensure 2 to 3 sessions per week of strength training. This is especially important after the age of 40. Number 5, improve sleep. Less than 6 hours of sleep per night increases hypertension risk. Sleep deprivation raises cortisol and sympathetic activity. Fixing your sleep can lower BP normally. Number 6, manage stress. Chronic stress keeps your nervous system in fight or flight mode. Consider breath work, prayer and reflection, time off screens, structured downtime. Stress management is cardiovascular prevention. Number 7, limit alcohol and stop smoking. Alcohol raises blood pressure. Smoking damages arteries, reducing both as immediate cardiovascular benefits. So, when do you need medication? Lifestyle change is foundational, but if blood pressure remains consistently above 140 over 90, or you have diabetes or kidney disease, medication may be necessary. This is not failure, it's protection. Often, we combine both lifestyle and medication. How do you monitor blood pressure at home properly? Sit quietly 5 minutes, back supported, arm at heart level. No caffeine 30 minutes before. Take 2 readings, morning and evening. Record for 7 days and bring the results to your GP or family doctor. This gives a more accurate picture than a single clinic reading. Now to the final takeaway. High blood pressure is common, but it is modifiable. Small consistent changes like reducing salt, moving daily, improve sleep, and managing stress can significantly reduce stroke and heart attack risk. Measure it, understand it, and act early. Check your blood pressure at home and comment your readings below. Next episode, we talk about pre-diabetes, the warning signs most people miss. Subscribe for lifestyle prescriptions with Dr. Jide. Stay intentional about your health. Bye.